Hello and welcome. Today we're talking about a widely used medication for digestive health, Omeprazole. You may have heard of its brand name, Prelosec, but whether generic or brand name, its primary function remains the same: reducing stomach acid to help manage conditions like acid reflux, heartburn, and ulcers. So how does it work? And how can it be used safely? Let's explore everything you need to know about Omeprazole. Let's start by understanding why stomach acid is important. The stomach naturally produces acid to help digest food and kill harmful bacteria. However, sometimes this acid can become excessive, leading to discomfort, inflammation, and conditions like gastroesophageal reflux disease, GERD, ulcers, and Zollinger-Ellison syndrome. When acid flows back into the esophagus, it causes a burning sensation known as heartburn. Over time, untreated acid reflux can damage the esophagus, leading to further complications. Omeprazole belongs to a class of medications called proton pump inhibitors, PPIs, which reduce the amount of acid produced in the stomach. By lowering acid levels, Omeprazole helps relieve heartburn, allows ulcers to heal, and prevents damage to the esophagus caused by acid reflux. It's often prescribed for long-term management of GERD and other acid-related conditions. So, how does Omeprazole work inside the body? The stomach has tiny pumps in its lining that produce acid to aid digestion. Omeprazole blocks these pumps, significantly reducing acid production. This helps maintain a balanced environment in the stomach, preventing irritation and allowing damaged tissues to heal. Unlike antacids, which provide immediate relief by neutralizing acid, Omeprazole works over time to prevent excess acid from forming in the first place. Omeprazole is usually taken once a day before meals to ensure effectiveness. It's available in tablets, capsules, and powder forms for different treatment needs. Since it works gradually, it may take a few days to feel full relief. That's why it's often recommended as a longer-term solution rather than a quick fix. One common misconception is that heartburn medication should be taken only when symptoms appear, but for people with chronic conditions like GERD, consistent daily use helps prevent symptoms before they start. However, Omeprazole should only be taken as directed by a doctor, since long-term use may require monitoring to avoid side effects. What about side effects? Most people tolerate Omeprazole well, but some may experience mild symptoms like nausea, headaches, or stomach discomfort. Long-term use may be linked to certain risks, including nutrient deficiencies like reduced absorption of calcium or magnesium, and an increased risk of infections. That's why regular checkups with a doctor can help ensure safe and effective use. Omeprazole can also interact with other medications, including certain antibiotics, blood thinners, and supplements. Additionally, lifestyle factors, such as excessive alcohol consumption or smoking, may reduce its effectiveness. If you're taking other treatments, it's best to consult with a healthcare provider about potential interactions. To wrap things up, Omeprazole is a powerful and effective medication for managing acid-related conditions. It works by reducing stomach acid production, relieving heartburn, supporting ulcer healing, and protecting the esophagus from damage. However, taking it correctly and combining it with healthy habits, like a balanced diet, avoiding trigger foods, and maintaining a stress-free routine, helps improve digestive health. Thanks for listening, and take care of your stomach. This video is for informational purposes only and does not substitute professional medical advice. Always consult a qualified healthcare provider for personalized recommendations.